Hello, it's Dr. J from the Healthy You. And today we have a special guest. Our topic of the show is Understanding Anxiety, a conversation with a psychologist. I have today as our guest Dr. Christy Cabrera, and she's a board certified clinical psychologist specializing in behavioral and cognitive psychology. She's the founder and the sole proprietor of Renewing Spirit Therapy for Women based in Jacksonville, Florida. Her practice emphasizes the assessment and treatment of anxiety and behavioral issues and chronic health conditions using empirically supportive cognitive behavioral interventions via telehealth. Her career spans over 15 years. Dr. Cabrera has extensive experience in clinical practice, leadership, and education. She holds a doctorate in philosophy in clinical psychology from the University of Houston and is licensed in Florida and Georgia. She's published in peer reviewed journals and is an expert and a leader in the mental health field, nationally and locally. She is dedicated to fostering mental health awareness, advancing evidence based practices, and supporting diverse communities. Defines her as a leading voice in contemporary psychology. Welcome, Dr. Cabrera.
Thank you for having me today.
So let's get started. Let's talk about anxiety. What is anxiety, and how do we know if we have anxiety or are we just feeling anxious?
Great question. That's actually one of the questions that I ask my clients when I'm meeting with them for our first session together. I think demystifying anxiety is so important for treating anxiety. So, anxiety, number one, is something that we all have. If you're a human being, you experience anxiety. So, anxiety is an emotional response that you experience when you anticipate a threat. So, I really like to emphasize the anticipation portion. So, anxiety is something that is future oriented. It's us projecting about what might be potentially risky or threatening in the future. That's different from fear. As a human being, we all experience fear. Fear is present oriented. It's right now. I'm in danger right now. So again, anxiety is future oriented and it's an emotional response to a perceived or an anticipated threat, risk, or danger.
Wow. Okay. If I'm afraid of what may happen in the future because I feel like gloom and doom, is that anxiety or is that a fear?
So if it's about something that is yet to happen, then it's
Mhm.
anxiety.
It is anxiety.
It
Okay.
is anxiety. Yep, yep.
And so, how does that manifest? Is it different in children, teens, elderly, adults?
Anxiety has core features that we see regardless of age. They may present a little differently, but those core hallmark features are always present. And so those core features would be physiological symptoms, so changes in your body, cognitive symptoms, which are typically thinking the worst, so negative thoughts. And then there's a behavioral component. So it's typically avoidance or escape behaviors. And if you can't avoid or escape, then you figure out a way to cope. So those are the core components of anxiety that we see across the developmental span. But yes, it can present a little differently in children. In young kids, you might see bedwetting, you might see school refusal, you could see tantrums, um, I had a client reflect on her childhood, noticing that she experienced anxiety in kindergarten, and she said she stayed in one spot the entire day. She
Oh,
was so
wow.
anxious about being away from her mom. As a little kid, she stayed in one spot. So that's avoidance. And then in your teenage years, rather than tantrums, you might see a lot of irritability. You could also
Okay.
see grade slipping. You could still see school refusal. You might notice that there's a withdrawal from
Hmm.
social activities, so that taps into avoidance. And there could also be some sensitivity to criticism.
Oh, okay.
Mm-hmm. Mm-hmm. And so this is all these presentations all needs to be considered within the context, so not
Hmm.
just looked at by themselves. But in adults, typically again we kind of see those core features present classically. So worrying a lot about the job or the family, maybe avoiding social settings, maybe avoiding bills, and also the physiological experience of maybe heart palpitations, sweating. So that's how it can look. But again, those core features are present across the developmental span.
Is it a little bit different in the elderly, or is still those core features?
Those core features are still present. Absolutely. I worked with a 90-year-old who was in a nursing home, and she presented with one of the classic behavioral symptoms of avoidance. She was scared of potentially getting sick by interacting with the other residents, so she stayed in her room. So that's a classic symptom of behavioral avoidance.
The avoidance is a symptom of anxiety. Is there a difference between avoidance and isolation that's due to depression, or how does that work? Or is anxiety part of depression?
Okay, very good questions. Let's see if I can tackle this. All right. So, if we look at avoidance, that would fall under the core component of behaviors. So, avoidance is not approaching something, not confronting something.
Okay.
If we look at the symptoms of that are within the behavioral component, avoidance, so
Hmm.
not approaching, not confronting. Then you have escape behaviors, which
Okay.
is I try to go into that store, but I get
Mhm.
so nervous that I leave. So
Okay.
I tried to approach, but I couldn't stay in the situation, so I booked it out of there.
Okay.
Um, so um, and then we have safety behaviors, so those coping strategies. Like, so if you can't avoid it, I have to go to work. You can't escape it. I've got to, present to the office today. So how can I cope? Okay, so maybe I make sure that I have my medicine right there, just
Okay.
in case.
Okay.
Maybe I'll take a little sip of alcohol to calm my nerves before I go in there. Or maybe I make sure that I have my water bottle just in case my mouth goes dry.
Okay.
So I just wanted to first clarify that the avoidance behavior falls under the umbrella of the behavioral component of anxiety.
Okay.
There is a behavioral component of depression. With depression, we also see avoidance. We see some avoidance that may look like difficulty getting out of the bed. So that kind
Oh,
of taps into fatigue as well as I just don't want to face the day.
okay.
It could
Okay.
also present as, you know what, I'm going to avoid social interactions because I just know that people think that I'm dull and boring and they don't like me. That is just how it would manifest in depression. Avoidance is a symptom that falls under the behavioral component umbrella.
Okay.
Mm-hmm.
Okay. What are some warning signs for people to understand or to realize when their normal anxiety is turning into uh, a mental health issue that they need to seek help from you?
Mm-hmm. That's a really great question. I mentioned earlier that we all have anxiety. So, anxiety in and of itself is adaptive, it's useful. We need it to survive. That's why we all have it. It is part of what has enabled us to exist. But when does anxiety move from adaptive and helpful to problematic and unhelpful? And there are two signs when anxiety becomes a problem. So when anxiety interferes with you doing the things that you want to do, interferes with you going to work, interferes with your relationships, interferes with your ability to attain the things that are important to you.
Okay.
That's one clinical indicator. Another clinical indicator is when the severity of your anxiety is significantly different from what others experience. For example, if we're going to the Grand Canyon, looking over the edge, I think we're all going to be like, oh, that is a long way down. But if you can't even bring yourself to go to the Grand Canyon because the fear of heights is so severe, that is an indicator that it has become a problem. So if it interferes with you doing the things that you want to do, and if it's significantly different from what others experience, and I guess there's a final one too, a clinical indicator, is how much distress does it cause you?
So, with the anxiety, does this run in families or is this caused by, like, what do we know what caused the anxiety? Is it stress or food we eat or?
Another great question that we are still trying to find the answer to. What we do know from the research is yes, there is a genetic component to anxiety. It tends to run in families. So, because a relative has anxiety, it doesn't mean that you will go on to develop a problem with anxiety. What it means is that your genes and your environment set the stage for the potential for the onset of an anxiety disorders. That's all it means, is that your genes, in combination with environmental experiences, set the stage. A number of things would have to happen in order for it to bubble over into what we would describe as an anxiety disorder. So things like chronic stress plays a role in, the body's response to stress and the susceptibility to the development of problematic anxiety. There's a lot of research that does show that, the types of foods that you eat can also increase your susceptibility. But what the bulk of the research is showing, that it's not one thing, it's multiple factors in combination that set the stage for the onset of problematic anxiety.
Okay, great. Let's turn to once a person realizes that their anxiety is not normal and they're having the avoidance behaviors and it's affecting going to work, relationships, they reach out to you. Then, what are some of the, are there medical treatments? Are there non medical treatments? Are there holistic treatments? What's the average approach?
There are a number of different approaches to addressing anxiety. As a psychologist, we're going to reach for evidence-based treatment interventions, and one of the gold standard approaches to addressing anxiety and anxiety disorders is cognitive behavioral therapy. And so cognitive behavioral therapy helps people to identify the thoughts, so that cognitive component, the thoughts that fuel the anxiety, it really help to examine them and to get to a point where you were able to identify whether your thoughts are helpful or unhelpful, balanced, imbalanced, rational or irrational, and help you to change your thoughts so that they are more balanced, rational, logical. It also involves the behavior. So we put a lot of emphasis on the behavioral component of anxiety, so the avoidance, escape, coping behaviors. So helping you to approach those things, move closer to those things that you've avoided, so that your brain and body will get in sync and learn that the things that you think are fearful may not necessarily be as fearful as you believe them to be. So you have to approach it in order to learn that. Those are the two big components of cognitive behavioral therapy. There are also medicinal approaches. So medication, the first line of treatment are the SSRIs, so the selective serotonin reuptake inhibitors, and they affect the reuptake, so the reabsorption of neurotransmitters that play a role in anxiety and mood. The benzodiazepines, things like Valium, Xanax, not first line treatments. They come with a lot of side effects and risks. People do have experienced benefit from medications. Research has shown that therapy is effective in reducing anxiety, improving mood. Medication is effective in improving anxiety and mood. And in combination, there's a bump. There's a bump. So there's research that says actually the two in combination are best. And then, yes, there are alternative approaches. There's a lot of research that shows that exercise, yoga, dietary changes like decreasing your sugar intake, decreasing your intake of caffeine. Caffeine revs up the body, so of course it's going to rev up your anxiety. Those types of treatments, including mindfulness, meditation, those have shown benefit in reducing anxiety as well.
If one of your patients said they do not want to take the medication, so the options would be to try some of those things and still do the cognitive behavior therapy.
Yes.
And changing diet.
Absolutely. And incorporating exercise and reducing their stress. So it would be a layered approach, but absolutely. Medication does not have to be on board. And it really depends on the severity of the symptoms and what your treatment goals are. But absolutely, the research is clear. Therapy alone can reduce and improve your anxiety and depression.
Let's talk about therapy and the definition, because I know a lot of people like, oh, I talked to my pastor, or I talked to I have a friend that I talk to. Can you explain why it's so important to get a certified therapist to do behavioral?
Yes, thank you for asking that question. I think that there is truly a difference between support and therapy. So you can get a lot of support from your community, from your circle of friends, but that is not the same as therapy. Therapy is designed to really focus on helping people change their behaviors, change the way they're thinking. It is designed to promote benefit, because not only are you talking to someone who's providing support, but they're also providing evidence-based strategies on how to move you from point A to point B. They are using research. A licensed clinical psychologist is using research-backed strategies to help you change. So we're doing more than just listening to you. We're doing more than just being a place for you to vent. We are actually helping to promote change by giving you access to those strategies that help you to get moving in the direction that is meaningful to you.
And so would you say it is also important that you pick your therapist on a relationship, how comfortable you feel with them?
Absolutely. We call it therapeutic rapport. That is so vital. You need to feel comfortable with someone. You need to feel like you can trust them. You need to feel like you're not being judged for bringing yourself to therapy. So absolutely, you want to feel comfortable and as though you can build a relationship with, a therapist. And You want to be thoughtful about that therapist or that psychologist's background. Do they offer those interventions that resonate with you, that have been shown to help a person um, reduce depression, reduce their stress, reduce their anxiety, improve their relationships, position them to be able to take advantage of opportunities that come their way? Do they have the training and background in order to support your goals? So I think that's important as well.
In today's market, everybody has telehealth on social media platforms. But part of being an advocate is you have to read people's backgrounds. What's the difference in, I'm trying to think the proper way to say this,
Mm-hmm.
psychologists versus social workers that are trained versus these counselors, these lifestyle coaches that are advertising as doing behavioral therapy? Is that possible, or is that a marketing ploy?
I
How would you
understand.
address that?
Yeah. How do you discern?
How do you discern?
Who's
Right,
who?
right.
Yeah, and how do you know what to look for? So yeah, just like with food labels, you do have to know the language. Number one, I would say, okay, so yes, there's a difference in all of those.
The above.
Yes, there's a difference, absolutely. Um, I would say one key word to look out for is licensed. That means that the person is going to be held legally responsible for the things that they say and do, that
Okay.
they are licensed within a state that is regulating their field. Now, a certified person, that means that they've done some training
Mm-hmm.
to address a particular concern, but a certification is not the same thing as a license. So
So let's repeat that. A
yes,
certification is not the same as a license
yeah, yeah, yeah.
when you're picking your therapist.
When you're picking your therapist,
Okay.
absolutely. Well, a licensed mental health counselor is different from a licensed clinical social worker. It's different from a licensed clinical psychologist. And those differences are related to the intensity of the training
Okay.
and the years of schooling. I can't speak to the hours that are required for a licensed mental health counselor and such. A typical psychologist has gone through at least 5 years of graduate work and an internship. In order to go to internship, you had to accrue a certain number of clinical hours. That's well over 1,000. When you get to internship, you have to accrue at least 2,000 hours of supervised clinical experience. From that point, you have to pass your national licensing exam. But prior to being able to sit for your licensure for your state, you have to have another 2,000 hours of postdoctoral training. So for a clinical psychologist, that's 5 years, 4 years of coursework, a year of predoctoral
Right.
training, 1 to 2 additional years of postdoctoral training, passage of a national licensure, and then you have to pass the state licensing exam. So for psychologists, it really represents that this person has been intensely trained.
And an
Um,
expert.
yeah, yeah.
Yes. And so when dealing with mental health issues and issues in your mind, you want an expert. This is why you have to be an advocate. This is why you have to read. You have to do your research before you allow people into your space, into your mind. Mental health. So the last thing I wanted to talk about is social media. Do you think it contributes to increased levels in anxiety in our teenagers and young adults and some of our older people from the constant scrolling and comparing themselves to people that they know that are putting posts that a lot of them aren't real, and
Yeah.
they do not have the possessions, and they're not traveling everywhere because AI is real. So do you think it
Mhm.
contributes to anxiety?
There's certainly a line of research that says yes. Yes, it does. Not only does it impact anxiety and stress levels, yeah, it impacts levels of depression. There is certainly a need to engage in critical thinking as it relates to social media use, and balance. Of course, there's also a lot of research that says no, it doesn't negatively, affect
Mm.
anxiety. But there is an increasing body of literature that says absolutely there are some mental health related effects from excessive social media use.
Okay. You've been practicing for a while and your whole journey of becoming a clinical psychologist. Have you seen a change in the patients that you've seen over the years since social media? Because you were practicing before social media, in the
Mhm.
anxiety and the depression?
That is true. Social media use has impacted the content of anxious thinking, and it has definitely been a notable trigger of
Mm,
anxiety. My younger clients definitely, in their 20s,
right.
they are quite vocal about, seeing, other people's profiles, and they want, to have that body, that life, and feeling as though, oh, I'm not where I should be because they're comparing themselves to others.
Yeah.
So absolutely, I've seen that become an increasing part of my practice, and part of the work that I do. Mm-hmm.
Well, it was a joy having you on today. Can you leave our audience with three things about anxiety and how to get help, or what do you want to say to them?
That there is help, that this is one of the most treatable conditions, and that there are effective, non-time consuming, non-cost consuming treatments that are available, and that the American Psychological Association is a great starting point to find a licensed clinical psychologist that can offer you the services that you're interested in.
Awesome. And so now, if you could tell them about how to reach you, how to find you, social media, all of that.
Yes. So again, the name of my practice is Renewing Spirit Therapy for Women. You can find that by Googling me. I also have a Facebook page, and you are more than welcome to check out my website at renewingspiritllc.com.
Awesome. Well, thank you. And to all of you who came in today to the Healthy You, just remember your health is greater than your wealth, and your mind is your health. Have a great day.
Unbreakable by Dr. Shirley E. Jones is now available on Amazon.